Anaesthetists are highly skilled doctors, specially trained to look after you before, during and after your operation, including managing your pain relief. The correct choice of anaesthesia and post-operative pain relief are important. They will enable you to be ready to get out of bed and walk soon after surgery, can improve recovery time and reduce complications. Before your operation, the anaesthetist will visit you and ask you some questions. These are about your general health and fitness, whether you've had any previous anaesthetics, and any allergies you might have. Please ask questions and tell the anaesthetist about any worries you may have. Your anaesthetist will discuss the different anaesthetic options available to you, either a general or spinal anaesthetic, which may be combined with nerve blocks. A spinal anaesthetic is often the preferred anaesthetic option for joint replacement surgery, as it provides excellent pain relief in the first few hours afterwards and avoids many of the side effects of general anaesthetics such as sickness and drowsiness. A spinal anaesthetic, or spinal, is a safe alternative to a general anaesthetic. During a spinal, local anaesthetic is injected into the lower part of your back, which numbs the legs and the lower half of your body. If you agree to have a spinal, you and your anaesthetist can decide together whether you remain fully awake during the operation or would prefer to be sedated so that you feel sleepy and relaxed. The effect of the spinal will wear off after a few hours, and with the help of the physiotherapists and nurses, you may be able to take a few steps on the day of surgery on your new hip or knee. An alternate anaesthetic option, which is also often performed for these surgeries, is a general anaesthetic. This produces a state of controlled unconsciousness for the period of surgery, and strong pain relief medicine will be given alongside this. It's normal to be worried about your pain after your operation. We can't promise that you'll be completely pain-free, and some level of discomfort should be expected. However, we will make sure that you're as comfortable as possible using a combination of different pain relief medication and techniques. The techniques used for pain relief in theatre include local anaesthetic injections around the joint and the wound done by the surgeon during the operation, and nerve blocks with local anaesthetic performed by the anaesthetist in the anaesthetic room to numb a certain part of your leg. The effect of both of these things can last for several hours after the operation.